Una, welcome to my YouTube channel, Dr. Winnie the Pharmacist for Pidgin English. If una just dey see this fine face for the first time, my name na Dr. Winnie. I be board certified pharmacist and practicing herbalist. For this my YouTube channel, na so health matter na we dey follow talk for here. The essence of this channel na to provide health education to many people so that people go fit change their lifestyle, people go fit dey do better thing with their health and their health go improve. Today the topic when I go dey look for here be low blood pressure. I wan tell una don hear about low blood pressure before. You know say you get high blood pressure, you also get high blood sugar. The one wey they call high blood pressure na hypertension be that, and the one wey they call high blood sugar na diabetes be that. Most of the time na only those high thing we dey usually talk. Those ones dey kill o. However, I want make una know say even the one wey dey low dey kill. Una know say low blood sugar dey kill fast, e dey kpai person fast pass even high blood sugar. The same thing apply to low blood pressure. Another name for low blood pressure na hypotension. Low blood pressure na that one dey clear person fast. You no dey even waste time. In few days or hours, e fit clear the person go. So you see, and many times most people or even most doctor or healthcare provider, their eye dey usually dey for high blood pressure much because high blood pressure dey plenty, but low blood pressure kuku dey kill. So today for this channel, wetin we go dey talk about na low blood pressure. We go look wetin be low blood pressure, then we go come look wetin low blood pressure fit do and how to avoid am. So without waste of much time, more quick dive into the matter and begin to dissect am. I wan make una know say the medical name or the scientific name for low blood pressure na hypotension. For this video today, I go dey swing from low blood pressure to hypotension. If una hear me I talk low blood pressure or hypotension, all of them mean the same thing. Hypotension na one condition wey fit happen when blood pressure dey lower than normal. If hypotension or low blood pressure happen, e mean say the heart, the brain and other parts of the body, they no get enough blood supply. And make I tell una, blood flow or blood supply to the brain, the heart, the liver and any other part of the body dey very important in order for the body to get oxygen and nutrients. So if blood flow come dey small or say e no dey enough, e mean say this part of the body when I don call, na be say the heart, the liver, the brain and other parts of the body, they no get enough nutrients. That means they no get enough food and they no get enough oxygen. And we know say oxygen dey very important to the human body. As we dey progress for this video, as we dey move, as we dey go, I go tell una the importance of oxygen to the body. I also want make una know say the heart, the brain and the liver na the three organs. No be say other organs no dey involved, but these ones na the three main organs wey need plenty oxygen pass other tissues or other organs for body. For body, only the brain dey consume or dey use 18.4% of oxygen wey dey for body, while the heart dey chop 11.6% of the oxygen wey dey for body. But I wan tell una, na liver dey chop pass o. In fact, only liver dey chop 18.4% of oxygen wey dey for body. Now all this oxygen wey all these tissues and organs dey chop, where you think say dem dey get am from? From the blood, of course. So you can see, if you can't get insufficient blood, that is say blood no reach, e no dey enough to pump round. You know say problem go don dey o, plenty problem, boku go dey. So you see, as I don talk am for beginning of this video, this plenty grammar wey dey speak so, low blood pressure simply mean say the blood pressure dey lower than normal. Mean say blood no too dey, therefore the pressure come dey low because not enough pressure to pump blood no kuku dey now. So which blood will come pump? If blood dey, pressure go dey plenty, go push the blood up. But if the pressure dey low as a result of low blood supply, say blood dey small, then no pressure to pump now, no blood to flow. And if blood no come flow, the organs and tissues wey dey for body, starvation go enter because they no get oxygen and they no get nutrients or food. No say blood, like I talk before, na him dey transport oxygen around the body. Now that oxygen, the body dey take am to break down food so that the food go dey accessible, that is, e go dey reachable to the organs and tissues. Una just understand am like that. And if these organs no come get the oxygen and nutrients wey dem need as a result of this low blood pressure, that's low blood supply, e mean say organ injury go kuku begin to happen, and these organs and tissues dem fit die. So at the end of the day, we will get organ injury and organ or tissue deaths. Like I don talk, if blood flow to the brain come dey reduced, dem dey call that kind thing ischemia. For science or for medicine, then they call am ischemia. No mind all this big grammar. Ischemia, the simple meaning be say the blood flow dey reduced. Now if blood flow dey reduced to the brain, that is ischemia, this thing when I just talk now, it means say the brain no go get oxygen and e no go get food or nutrients. So the brain cells go come dey malfunction. They'll come dey malfunction. Sometimes sef, part of the brain cells fit to stop work, go just stop the work. And if that kind thing happen, it means say the person go just get stroke. So you see, all these stroke wey dey hear, low blood pressure fit cause am. If stroke happen, e get one core area where blood dey completely cut off. And if that blood come dey completely cut off, the brain cells fit die within 5 minutes. They fit just die. And if the brain cells die, it means say we get wetin they call brain inactivity. Say the brain don dey inactive be that. My knack na one quick tori. Permanent brain damage fit start just only 4 minutes after brain no see oxygen take use. Just only 4 minutes, so person fit get permanent brain damage. You know wetin that one be now? Permanent brain damage be say person don kpai. Because if the brain don die, wetin person remain dey do? So lack of oxygen as a result of lack of blood supply or low blood supply due to low blood pressure fit cause life-threatening problems wey fit dey threatening to life, like comas and seizures. Una don hear coma before, but I go tell you na wetin coma be now. Coma na prolonged unconsciousness, when person dey unconscious. Now those kind of people wey get accidents before, where dem dey unconscious, dem no dey move, dem no even sabi where dem dey. Person no go sabi where im dey safe. Those kind of people, then they usually admit them for ICU ward for hospital. Na coma be that. Then seizure Seizure na abnormal burst of electrical activity for brain. Go make the person, even go change the movement of the person, the behavior of the person. That kind of thing wey dey happen when person get epilepsy na example of seizure be that. However, good news dey sha, and the good news be say low blood pressure dem fit treat am and dem fit avoid am. So na good news be that. Well, low blood pressure fit happen as a result of one thing or even several things, like plenty things. E even fit give person sign or symptoms, or if you even no give person the sign or symptoms say the person get low blood pressure. So sometimes you go dey see people, dem go dey waka, dem no go know say dem get low blood pressure. Na till when they fall or something serious like stroke come happen, that time go don late small, na any person go come know say e get low blood pressure. So e better make person get the one wey go give am sign, so that people go quick know, even doctor go quick know, dem quick fit help am. And if low blood pressure give person sign or show person sign, e mean say person need quick medical attention o. No waste time, kia medical attention to the rescue. Before we move further, may we look wetin normal blood pressure for adults suppose be. Normal blood pressure for adults be anything wey dey above 90/60 millimeter of mercury up to 120/80 millimeter of mercury. I also want make una understand say blood pressure get different value or different range for men and for women of different age. Wetin I mean by this statement be say, if person dey like 18 to 39 years or so now and him be woman, e mean say the normal blood pressure for that person go different from the same age grade, that is that same 18 to 39 years for man. Then a person dey like 40 to 50 years or 49 years, you know, that kind of thing. The normal blood pressure wey person go get at that age go still dey different from normal blood pressure of somebody wey dey like 18 to 39, and so on and so forth. Una understand? So blood pressure dey usually vary with age and sex. Men, they get their own different blood pressure, slightly different from women, and na so different people with different ages, they get different normal blood pressure range. Una understand abi? So make we carry on. And before we carry on sef, the reason why we get different blood pressure reading be say, imagine, you know say heart don dey beat. Person heart no be na when they born am na im the heart come dey beat o. No, when the baby dey inside belle, heart don begin work o. So heart don dey beat. So imagine say heart don dey beat since person dey inside belle till they born am, till e reach 18 years, 20 years, 30 years. You understand? So the pressure you get over the years, of course, go dey different, because e dey like pipe. They say person buy siphon. Una know wetin be siphon now? That kind pipe wey dem dey use draw water, and over the years water dey just pass through am. Check the new one, check the one wey dey old, then check the one wey dey take water flower, then they keep am under sun. Check the flexibility, the way, the softness. Go see say the new one dey different from the old one. The old one fit dey harder. You understand? So different factors dey affect blood pressure, you know. So age fit affect blood pressure. That's pumping every time. The bottom line be say person blood pressure dey change or dey vary with age. You know say the blood vessels or the network of blood vessels wey dey for body, the one wey dey call vascular system, e dey change with age. As I don talk am before, you know say person heart don begin pump everly since 30 for inside im mama belle before dem even born am. So as the blood come dey pump now, year by year, person come dey grow old, the artery or the blood vessel or the pipes for the body where they pass blood go dey thicker, go dey stronger and harder. Now make blood pressure go dey shoot up. Like I don't talk before, imagine say person buy siphone or that thing where they call tio and siphone are the same thing, and they water garden with am, they keep am for sun, they use am over time. If you check the new one and the old one, you go see say difference dey. The new one go dey soft. If una think say wetin I talk una no understand am, go market go check new tio, carry old one, hold am for hand. Even the tio wey dem dey take put fuel, draw fuel enter motor, you go see say the new one e dey soft, e dey flexible pass the old one. The old one go come dey hard kakaraka. Na wetin dey make blood pressure go up with age. Una understand am abi? So from age 18 to 39 years, the normal blood pressure for women na 110/68 millimeter of mercury. Wetin I mean be say the systolic pressure, that's the upper pressure, the contraction on, will be 110, and the diastolic or the down one, that is the dilation, the relaxation on, we just sabi am like that, will be 68 millimeter of mercury. So the normal blood pressure for women wey dey from 18 to 39 years old na 110/68 millimeter of mercury. The person dey within that range and e dey that age range, e mean say her blood pressure dey normal. Then for men under the age of 18 to 39 years old, the normal blood pressure range na 119/70 millimeter of mercury. Now understand? So any man within this age range of 18 to 39 years, when I don't call so, if in blood pressure range fall under 119/70 millimeter of mercury, e means say him blood pressure dey normal. For women under the age of 40 to 59 years old, the normal blood pressure na 122/74 millimeter of mercury. While for men under the same age, that is 40 to 59 years, the normal blood pressure na 124/74 millimeter of mercury. Then for age range of 60 years and above, anything wey reach 60 and pass 60, 70, 80, 90, 100, if woman get blood pressure 139/68 millimeter of mercury, we go say that blood pressure dey normal. So if the blood pressure fall under the range of 139/68 millimeter of mercury for woman under that age of 60 years and above, we go say the person get normal blood pressure. While for men under that same age range, that is 60 years and above, that is 60 years plus, when I dey talk so, if dem get blood pressure within the range of 133/69 millimeter of mercury, means say that blood pressure e dey normal. So because most times when low blood pressure dey occur or dey happen, e no dey show sign. You go just see person, or you could just say person just kpai, or person just fall, person just get stroke, you know, that kind of thing. They can't check because you say the person na low blood pressure na im get. That is why most times, you know, they dey easy to know how many people wey low blood pressure dey affect. Na im make e dey very okay for person to dey check him blood pressure always. You know say human being dey one kind. If person blood pressure dey high, na problem. If person blood pressure come dey low, na another problem. You know say this human being, like I don talk am before, say human being no be anything. Now wetin I mean when I say human being no be anything, they make mouth. You know who I am? Do you know who I this? Who did this? Now what I fit do? Small thing. Na small thing dey make person go just kpai. So make person dey careful. me, my advice to people where they watch me for here be say, una dey check una blood pressure regularly from time to time. And also say if blood pressure dey high, person go die. If you come dey low, person go kuku die again. Now wow. So make we kuku look the symptoms of low blood pressure. Wetin I mean by symptoms na sign. Something wey if the thing dey happen to you, you go know say this na the sign. If it be say I get this thing. So the symptoms of low blood pressure: 1, blurry vision or double vision or distorted vision. You go see say you go just dey see, maybe if I dey waka now, if you dey look me, I go appear like 2 people for your eye, or you no go dey see me clearly. Sometimes you get some people wey go dey complain say they no dey see clear or say dem dey see double. Person go come dey tell them, usually for Nigeria, if person no dey see clear, if he talk say maybe you never chop, people go dey talk say maybe you never chop. Na lie o. No be every time wey person dey see double na im be say person never chop or person dey hungry o. No. Sometimes if it be say na low blood pressure, na just all these small signs wey we dey usually ignore. You go come dey chop food. You go to chop food, but if na low blood pressure dey cause am, e no go solve anything. That double vision, e no go stop. Then the second symptom na confusion. See, person go just dey confused. You go keep something here, you no go sabi. Now, just don't keep something for here, or you talk to person, but it just dey confused. You no fit remember, you no dey coordinated. Now, one of the sign of low blood pressure be that. If you get this kind of thing, make you check your blood pressure to know whether it is normal. Now these things, you know, say God, they wonderful. You don't put different signs to show us say, okay, this one no dey okay, this one no dey okay. But most times you go see say human being they ignore them or they know sabi. Then they make person to buy, because they say knowledge is power. So you don't they see that when I dey talk. The first time when I do my intro video, say knowledge is power. If you not get this knowledge, then if you not take action, join them, then we go feel reduce debts and we go feel live better life. The third symptom of low blood pressure be say person go dey feel dizzy, your head go dey do like say one fly. You know that kind of thing. Now low blood pressure symptom be that. Also, person fit faint. For Oyibo and for English, then they call that one syncope. Now fainting. Person fit faint. Then vomiting, the fifth one. Nausea and vomiting, all of them are the same thing. Nausea means say the person go dey feel like say you want vomit. You don't ever feel like say you want vomit before. I would say they call nausea be that. And then the person feel vomit last. So all of these things are the signs of low blood pressure. Also, person go dey always feel sleepy, tired, fatigue, you know. Person go dey sluggish. If you notice say you dey sluggish, this tiredness or fatigue, even lethargic, all of them are the same thing. All these things are signs and symptoms of low blood pressure. So if you experience these signs and symptoms, or if you notice this kind of thing for your body, it will good make you check your blood pressure to know whether you still dey normal. Then another sign and symptom of low blood pressure be say person go dey quick vex. Small thing wey go no suppose make person vex, you go see the person go vex. They call that kind of thing agitation. Na still sign of low blood pressure be that. Then also, people with low blood pressure, it dey hard for them to concentrate. So if you dey find them difficult, or if it dey hard you to concentrate, just begin dey suspect low blood pressure. Then some people will get low blood pressure too, then they get stomach upset. So sometimes if your stomach dey upset you, check am more. If be say person get low blood pressure. Also, if person dey get fast shallow breathing, shallow na breathing wey no deep, something wey no deep, na wetin they call shallow for English. Like person just dey breathe fast but no deep, like if you dey notice that kind of thing, may you check your blood pressure to know whether you still dey normal or whether the thing don drop. Other things or pointers wey person go get, then go fit suspect say person get low blood pressure be 1, low cardiac output. Wetin I mean be say person heart no go dey pump enough blood. The output, that's the output of blood from the heart. The heart no dey pump enough blood. Na wetin they call low cardiac output. If person get this kind symptom, e mean say e fit be low blood pressure. The second pointer be low urine output. This one mean say piss go dey worry you, but if you go enter bathroom or toilet to go piss, na one small thing point go comot compared to the normal way wey you take dey urinate. Una fit relate to this thing when I dey talk. Sometimes you wan piss dey worry you, just enter toilet or you enter bathroom, you sit down, make you piss now. As you just enter that restroom, you sit down, make you come piss now. Na small thing go comot. You come dey worry, wonder say no the piss dey worry me like say tomorrow no dey. Where the piss come dey? If you dey get that kind symptom or sign, fit be say your blood pressure dey low. The third pointer be say if you dey get, or if your skin color come change, come dey lighter than normal, no be say you use cream or no be say you dey do any special thing, you just come notice say your skin color dey lighter than normal, that one na pointer to low blood pressure. The fourth pointer, number 4 pointer to low blood pressure be say person heart go dey beat too fast or too low, like boom 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 boom, too fast or boom 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 boom, too slow, too high or too low. A person check, fit be say low blood pressure don dey set in. Now the fifth one be say person knee cap. Una know wetin be knee now? The knee, that is where you get the joint between the leg and the laps. If that place dey cold, e dey cool, colder than normal, na also pointer say person fit get low blood pressure. Una know why low blood pressure dey cause fainting and dizziness? Na because the brain dey receive enough blood. That na the simple matter why e dey cause fainting and dizziness. So the common causes of low blood pressure fit be due to the one wey no be underlying disease. Wetin I mean by this be say e fit be say you no get any disease or anything before for your body wey dey cause the low blood pressure, but still you go get am. So these common causes like 1, family history. For some families, dem too dey get low blood pressure, na inherited something. Then the second one, a common cause of low blood pressure be due to medicine wey person dey take or person dey use. Like e get some kind eye drop or some drugs wey person dey use. So if you go buy drug for pharmacy or your healthcare provider give you medicine to take, e go good make una ask am say abeg wetin be the side effect of this drug, for those people wey no fit read. But for those people wey fit read, e good. Every medicine dey get leaflets. Na show una leaflets. I no get anyone like paper wey dey inside the medicine, and those leaflets dem dey write the side effects, the dosage, and many other things. So e go always good make you, before you take medicine, check the side effects so that you go know. If na drug wey you really need but the side effects na low blood pressure, then you go ask your healthcare provider say wetin you fit do, as you need this drug to solve this other problem, but see the kind problem wey e fit bring, wetin I fit do to counteract that low blood pressure so that I fit get the benefits of this drug while my blood pressure no go reduce. You understand wetin I dey talk abi? Other causes of low blood pressure be 1, orthostatic hypertension. This dey happen when person stand up too quickly.
If you dey sit down before, like the way when I sit down now, I just stand up all of a sudden, the body no go fit supply blood reach the brain fast or normal, because you just stand up quick. Now that one we call orthostatic hypertension. So please, if una dey sit down before, if una lie down before, may you just check up, just stand up like that. This kind orthostatic hypertension, they usually happen most times when person dey sleep. Then something go just happen, go just stand up like that with full force. E no good. Another thing wey fit cause low blood pressure na Parkinson's disease. Una no dey hear Parkinson's disease now. E plenty. E dey common, especially among Oyibo people. Na dem dey get Parkinson's disease more. So why be say Parkinson's disease fit cause low blood pressure? Na because Parkinson's disease dey affect the way the nervous system for body dey take control blood pressure. The third cause of low blood pressure na loss of blood, severe loss of blood due to accidents and injuries, and any other thing wey fit cause loss of blood. Una know say for English, loss of blood, another name na low blood volume. When person lose blood, blood go reduce for body, so then they call that one low blood volume. Dehydration, that is when person no get enough water for body, also fit cause low blood volume. The fourth cause of low blood pressure na irregular heartbeat, wey dem dey call arrhythmia. Heart attacks also and collapsed lungs fit cause low blood pressure. Also, e get some allergic reaction wey dem dey call for English anaphylactic reaction. That one too fit cause low blood pressure. Another cause of low blood pressure be sepsis. Sepsis na, simply put, immune reaction to infection. As person go get infection for body, then the body go react. The way the body take react to that infection fit cause wetin they call sepsis. Now how I fit explain am so that it go dey easy. Any other explanation, may you look your screen. I go explain am further for there. And that thing too wey fit cause low blood pressure be pulmonary embolism. Embolism, if you una hear embolism means say person gets blood clot for inside artery. I know wetin be blood clot. Like una don get wound before now, or maybe una don kill chicken or cut, or you get cut. If the blood dey flow, after the blood go come dey thick due to the mixture with air and oxygen, go come dey thick. That thick blood na we dey call blood clot. So imagine say person get blood clot for inside artery. Of course, e dey like stone now, e dey like blockage. In fact, na blockade be that. So if that thing come dey inside artery, you know say artery na pipe. Imagine say you can't get one thick something for inside this pipe wey stand for here, so blood no go fit pass well. If e reach here, e go stop, so e go block the blood from normal movement and normal passage. And I know say blood dey carry nutrients and oxygen, so e go block am off. That blockade na wetin we dey call embolism. Now if person talk say the pulmonary embolism, pulmonary simply means the lungs. So pulmonary embolism means say e get blood clots for inside artery wey dey inside the lungs. So now another thing wey fit cause low blood pressure. The seventh cause of low blood pressure na extreme temperature. Either when temperature dey too hot or too cold. This human being sef, small thing we go complain. If weather dey too hot, complain dey, problem go dey. If weather don kuku dey too cold, problem go dey. Now wow. The sixth cause of low blood pressure na pregnancy. And wetin dey cause low blood pressure for pregnancy be orthostatic hypotension. We don talk wetin be orthostatic hypotension before. However, orthostatic hypotension fit dey possible to occur inside pregnancy in the first and second trimester of pregnancy. Bleeding and other complications of pregnancy fit cause low blood pressure for pregnancy. So my advice be say make husbands dey look out for their pregnant wives. Na the advice wey I get be that.
Another cause of low blood pressure be alcohol and recreational drugs. Drugs wey dem dey call recreational drugs na drugs wey fit make person dey high. Na wetin dem dey call recreational drugs o. So alcohol and recreational drugs na don see say e fit cause low blood pressure. Even certain herbal supplements, vitamins and home remedies fit cause low blood pressure. The 8th cause of low blood pressure or hypotension, anywhere wey una see hypotension, e still mean low blood pressure. In fact, hypotension na the medical or scientific name of low blood pressure. So the 8th cause of low blood pressure na heart and lung problems. Like say make person heart dey beat too fast now or too slow, e fit cause low blood pressure. And if person lungs no dey work as e suppose dey work normal, e fit cause low blood pressure. The 9th cause of low blood pressure na advanced heart failure. For advanced heart failure, the heart muscle don dey too weak, so this go cause low blood pressure. The 10th cause of low blood pressure na prescription medicine. Wetin I mean by prescription medicine be say na medicine wey your doctor or your healthcare provider don prescribe for you to take. Some of the prescription medicine wey fit cause low blood pressure be the kind wey dem dey use for hypertension. Those ones fit cause low blood pressure. Also, drugs wey people dey use for erectile dysfunction, that is people wey their teen or their manhood no dey stand up well, so doctor fit give am drugs. Also, drugs wey dem dey take treat depression and neurological conditions fit cause low blood pressure. Even drugs wey dem take or carry treat heart failure dey cause low blood pressure too. So if person dey take these kind drugs wey dey cause low blood pressure and e come dey experience low blood pressure, make that kind person contact him health provider kiakia, quick, and make e tell am. And e dey always dey advisable say if you go dey tell your healthcare provider something wey dey happen to you or wey drug dey do to you, make you also kuku tell am everything wey you dey take, like food, like other drugs, anything like herbs, supplements, because healthcare providers dem no be magician. If you give them full information, dem go fit help you to solve your problem better. Una dey hear me so? May we quick look the complications of low blood pressure. One of the complications of low blood pressure be falls and related injury. Fall mean when person fall down, go just dey waka, go just fall down for ground. How many people get elderly people for their house, like your old mama or your old papa, go just dey waka, small thing go tell you say e fall? Make you check am well, fit be low blood pressure. The bad thing be say person fall down, person fit break bone or come get injury like nerve injury. I know say nerve injury no dey quick heal. Person hand go dey pain am, e joint fit dislocate sef, person even fit injure, get wound, so that thing no good. So na one of the complications of low blood pressure be that. The reason why people fit fall if dem get low blood pressure, because say low blood pressure dey make person feel dizzy, like fainting, tired. So na that be the simple reason wey person fit fall if you get low blood pressure because of that dizziness, tiredness, syncope, lethargy, all those things when I mentioned earlier. If you no remember, just simply rewind this video, look am again. As I don talk am before, no be only broken bones and nerve injury wey fall fit lead to. Falling down fit lead to mild traumatic brain injury wey fit happen as a result of jolt or bump or violent jolt or blow to one's head when the person fall. Falling down also fit lead to life-threatening injuries, so una don see as fall take be complication for low blood pressure. The second complication of low blood pressure be shock. When person get low blood pressure, the quantity of blood supply wey the organs go get go reduce well, and also the quantity of oxygen and nutrients. So those organs wey no dey get the enough blood supply now go come dey begin dey shut down, and this shut down can cause organ injury and organ damage. Na the shock be that o. As the organs come dey shut down, they fit get damaged and the organ fit injure, all due to limited blood flow and oxygen to these organs. The third complication of low blood pressure na heart problems or stroke. If blood pressure dey low, heart go try to compensate, go try to make the pressure dey normal, so you go come dey pump faster and harder so that you go fit compensate, so that blood go flow out. But remember say blood no dey enough, so the heart go just dey overwork because e go come dey pump, but no dey still pump anything, go come dey overworked. Imagine say you just dey, I no even know as I go take explain this thing now. Like you just dey work, you just dey exercise your muscles, dey overwork, and you no dey achieve anything. Na so e dey for low blood pressure. The heart go just dey pump, but wetin dey pump now? Nothing to pump. The blood no dey plenty, but for the heart own mind, the way the heart dey see am, e wan pump the blood, so e wan compensate so that things go dey normal. Na so God don make our body, but still nothing dey happen. So at the end of the day, the heart go dey tired, and the blood massive wey dey try pump go round, e still no dey enough. So the organs go come dey shut down too, because they no get oxygen and they no get enough nutrients. So over time, as the heart come dey pump like this due to low blood pressure, the heart go come damage now. It will come get injury. Things like stroke or heart failure and heart damage go set in. Una understand wetin I explain abi? So how person fit detect low blood pressure is simple, very simple. Una always dey check una blood pressure regularly. Na the only way to detect whether person get low blood pressure or e dey normal or e dey high. Now, make we look ways wey person fit reverse low blood pressure, that's make am to become normal. If person wan reverse in low blood pressure, that's change am so that e go become normal, person go increase the level of water or the fluid wey person dey normally take. That is number one. Number two be say person go increase salt intake. This salt wey we take dey cook food, go dey put am for water, dey drink am. So you go increase your salt intake, you go increase your salt for food. You get all these things, dey make blood pressure to jump back, low blood pressure to jump back to normal. Person also fit increase in blood volume through the use of IV fluid, wetin dem dey call drip. If una wan do this kind one, una see una healthcare provider for this one. Person go also chop fewer meals, that is, no go dey too chop plenty like that, and person go also lower in carbohydrate intake. So if you dey get low blood pressure, make you no dey too chop too much of or plenty of carbohydrate food. Another thing wey fit lower blood pressure be say make person avoid to stand up too quickly. Also, if person dey take blood tonic or blood tablet and folic acid or folate drugs, this one fit reverse low blood pressure and make am normal, because the idea there be say blood tonic and folate drugs or folic acid go increase the blood volume. E go help the body to produce blood. And wetin we dey look for low blood pressure na blood. Now if person get enough blood wey the heart fit pump around the body, then the low blood pressure go stop now. So na the idea behind am be this. Another way to stop low blood pressure be say if person dey feel dizzy or light-headed, im head dey light as if im dey fly, make person dey quick sit down, make person dey sit down, you understand. Another way to reduce low blood pressure be say make person drink less alcohol, or make person no even drink alcohol at all. That alcohol, I never see the benefit to take drink alcohol, I don hear am for my mouth. And make person increase in water intake. That man dey talk say alcohol don cost now, so make I know, maybe all these people wey too dey drink, dem go calm down small, because that thing get more disadvantage than the benefits. Another thing wey person fit do to reverse low blood pressure back to normal be say person fit wear compression stockings. Wetin compression stockings dey do to reverse low blood pressure? If person wear compression stockings for im leg, the compression stockings go put pressure on the feet, making the blood to move up, thereby increasing the blood pressure. Please, my advice be say make una always dey check with una healthcare provider, so that una healthcare provider go fit guide you better. Another thing wey fit reverse low blood pressure back to normal be say person go make a fist. See wetin I mean by making a fist? Then person go cross the legs, in leg. As you make this fist, you cross your legs, then you go clench your buttocks. E dey reduce low blood pressure. Before we go, make we quick look the drinks, different drinks wey person fit drink or take, so that e go fit reverse low blood pressure back to normal. If we go fit convert am to normal pressure. Number one, caffeinated coffee. That means say coffee wey get caffeine, e dey increase the low blood pressure back and make am normal. Then green tea and black tea fit increase low blood pressure so that e go dey normal. Beetroot juice, pomegranate juice, orange juice, lime juice, grapefruit juice, lemon juice, tangerine juice. In fact, anything wey dey inside citrus family, all citrus fruits, their juices fit increase back that low blood pressure and make am normal. Tomato juice also dey fit increase low blood pressure and fit go fit make am normal. So more na the people wey dey prone to low blood pressure or wey fit get low blood pressure easily, make dem dey chop tomato regularly. E good increase the low blood pressure and make am dey normal. Make we also quick look the different foods wey person fit chop to make the low blood pressure turn to normal. These foods include things like: number one, asparagus; number two, cruciferous vegetable. If una hear me talk cruciferous vegetable here, I mean all the vegetables wey dey in the family of cabbage. So cabbage, broccoli, lettuce, all na cruciferous vegetables. Also, green leafy vegetables, spinach, liver, groundnut or peanuts fit increase back the low blood pressure to normal. Beans, lentils, avocado pear, banana, cauliflower, all these foods fit increase back the low blood pressure to normal. So if una fit find this food dey chop am, e go help una. That's for people wey get low blood pressure. Eggs, Brussels sprouts, pawpaw, sunflower seeds, all of these things fit reverse low blood pressure and make am normal. Okra, banana, cantaloupe, peas, cauliflower, all these things fit increase back the blood pressure to normal. Even egg and beans wey you know fit increase back blood pressure to normal. So if una don watch this video to this point, and if una know any other food wey fit increase blood pressure from low blood pressure and make am normal, una drop am for comment section so that other people go kukuma benefit. As I don talk this one, this points bring me to the end of this video. So as I dey usually talk, I dey beg una, mona, if una like the content when I put out for this video, so mona kuku subscribe. E no dey cost anything, e no dey pay hand, na just point go subscribe. Then if una subscribe, mona kuku hit that notification bell so that una go dey aware anytime I drop video like this. Then also share am. Knowledge is power. Mona no just keep the knowledge to una sef, mona share am to friends, families and many other people, your social media group. Then mona like am now. If you see say you like this information when I don share with una, mona give my video thumbs up so that YouTube go dey suggest am to people wey need am. And lastly, mona put una comments for inside comment section. Any question una get, anything where they confuse una, or anything where you want make other people dey aware of, like anything where I no point out where I live or where I remain, una put am for inside comment section so that everybody go dey learn. Even me ma wey dey make video, me ma go dey learn, because iron sharpen iron, we learn from each other. So na the small message when I get be that. With all these my few points, I don't finish the video. Till we meet again next time. God bless all of una. Bye bye.